Knock, knock, knock.
Come in.
Okay, upon entering the patient's room, I'm going to be performing hand hygiene with sanitizer and closing the door behind me to protect patient privacy. I'm going to introduce myself and get consent for the exam. So hi, my name is Madison. I'm your nurse practitioner today. Can you tell me your name and date of birth?
Chaz Mikowski, 05/30/96.
Okay, and what brings you in today?
Physical exam.
Okay, for the exam, I'm going to be touching you. Is that okay?
Yes.
And if you have any pain or tenderness throughout the exam, just let me know.
Okay.
So general survey of the patient. He is alert and responsive. His speech is clear and audible. He appears well nourished, well groomed. His attire is appropriate for the exam. His skin color is appropriate for ethnicity, no cyanosis, no visible wounds or lesions. Touching his skin is warm and dry. Texture is smooth. Skin turgor is good. There's no signs of tenting or dehydration. Moving on to the head exam, I'm going to touch your head, palpating the cranium. It is normal, cephalic, atraumatic, no obvious deformities. Scalp is clean, no lesions or masses felt. Hair is evenly distributed, no areas of alopecia. We're next going to palpate the sinuses, so I'm going to touch and let me know if you have any tenderness. So for the maxillary sinuses, going to palpate. Any tenderness?
No.
Okay, and for the frontal sinuses, any tenderness here?
No.
Okay. Next, assessing for nasal patency. I'm going to have you close one nostril and take a big deep breath in and out. Good, and again on the other side. Good, so the nares are patent bilaterally. Next, we're going to examine the mucosa. So you can tilt your head back, and I'm just going to look for the light. Okay, so the nares are pink and moist, the membranes bilaterally with no discharge. We're going to move on to assessing the eyes and the eyelids. So the eyelids are symmetric bilaterally, no ptosis. Eyelashes are evenly distributed. The sclera are white. I'm going to have you look away from me that way and pull down. The conjunctiva are pink and moist, no erythema, no discharge. I'm going to have you look at my nose and shine a light in your eyes to assess your pupils. Good. The pupils are equal and reactive to light. Look at my finger. Now look behind me. Okay, pupils are reactive to accommodation as well. I'm going to have you follow my finger. We're going to assess the 6 cardinal gazes. So with your eyes and your eyes only, just follow my finger. Good. So next we're going to take a look at the eye one more time, shining one more light. So just look at my ear over here. Okay, red reflex is present bilaterally. The retina and vessels are intact with no abnormalities. The optic disc is well defined, and the macula is pink with no abnormalities, or intact with no abnormalities. By that assessment, we can verify that cranial nerves 2, 3, 4, and 6 are intact. Assessing cranial nerve 1, we would be verifying that smell was intact with either coffee or peppermint. We don't have that, so for the sake of the video, we're going to bypass that exam. Next, we're going to examine the oral cavity. So go ahead and open your mouth. Just gonna look. Okay, teeth are in good repair. No obvious caries. Tongue is pink and moist. Buccal mucosas are pink, moist. No lesions are present. I'm gonna palpate the temporomandibular joint. Go ahead and open and close your mouth a few times. Any tenderness?
No.
Okay, no tenderness, no clicking, so TMJ is within normal limits. I'm gonna have you smile, stick your tongue out, move it left and right. Okay, puff out your cheeks. Good. Open and say ah.
Ah.
And push your shoulders up, shrug up. Push your head against my hand and turn the other way. Good. So cranial nerves 5 and 7 through 12 are also intact. We're going to move on to assessing the ears. I lost my attachment. So assessing the ears by inspection, the external auricles are symmetric, no erythema, no discharge. Pulling the pinna up and back to examine the ear canal. Okay. Okay. The canals are patent with no obstructions. The tympanic membranes are intact with visible cone of light and visible landmarks bilaterally. I'm going to next palpate the mastoid process. Any tenderness?
No.
Okay. And we're going to perform the Weber test. So I am going to tap this. You're going to hear a sound. It's going to be on the top of your forehead, and you're going to tell me if you hear the sounds equal in both ears, okay?
Yes.
Equal in both ears?
Yes.
Okay. I'm going to next perform the whisper test. So I'm going to whisper something on each side. Just repeat what you hear.
A, B, C. 1, 2, 3.
Okay, so hearing is intact and equal bilaterally with no deficits. We are going to go back to the eyes and do the visual acuity test with the Snellen chart. Okay, so covering your left eye, I want you to read the lowest line that you can see.
L, T, F, F, H.
Good, now cover the other eye, same thing.
L, T, F, F, H.
Perfect. So visual acuity is 20/20 on each eye. We're next going to examine the neck. So looking at the trachea is midline. No obvious signs of jugular vein distension. We're going to auscultate the carotid arteries bilaterally. And we're going to listen with the bell of the stethoscope so you can breathe normal. Chin down a little bit. Okay. And hold your breath. Good. So auscultating the carotid arteries, there are no bruits present bilaterally. We're next going to palpate the lymph nodes and assess the lymph nodes. So we're going to start with the pre-auricular lymph nodes. Any tenderness?
No.
Okay. Post-auricular? Any tenderness?
No.
Okay. Tonsillar lymph nodes? Any tenderness?
No.
Submandibular? Any tenderness?
No.
Submental? Any tenderness?
No.
Okay, moving on to the anterior cervical lymph nodes. Put your chin down a little bit for me. Okay, any tenderness?
No.
And posterior cervical, any tenderness?
No.
Okay, so no lymphadenopathy present. The lymph nodes are mobile and non-tender and pea-sized. We're going to move on to the anterior thorax. So we're going to start by auscultating the lungs in 8 fields. Oh, my contact. Okay, big deep breath in and out. Again. 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 And again. Okay, good. We're going to assess for tactile fremitus. So I'm going to palpate down the front of your chest, and you're going to repeat 99, 99, 99 until I tell you to stop. Okay, go ahead.
99, 99, 99, 99, 99.
Good. So vibrations are equal bilaterally. We're going to assess heart sounds. So we're going to start with the aortic, which is going to be on the left in the center second intercostal space. Okay, and moving to the pulmonic in the second intercostal space. Moving to Erb's point in the third intercostal. Then the tricuspid in the fourth intercostal space. And then listening at the mitral valve in the fifth intercostal space at the midclavicular line. Okay, and in the clinical setting, we would also listen with the bell of the stethoscope for the sake of time in this video, we're going to bypass that. Listening to the heart, the rate and rhythm are regular with normal S1 and S2 sounds, no murmurs, rubs, or gallops. We're going to palpate the point of maximal impulse, which again is going to be the fifth intercostal space at that midclavicular line. And it is in the fifth intercostal space, midclavicular with no displacement. We're going to now assess the posterior thorax. So I'm going to spin you around here. And again, we're going to start by auscultating the 8 lung fields. Deep breath in and out. I lost my spot there. Deep breath. And deep breath. Again, we're going to assess for tactile fremitus. So again, I'm going to palpate down the lung fields, and you're going to repeat 99, 99 until I tell you to stop. So go ahead.
99, 99, 99, 99, 99, 99.
Good. Again, vibrations are equal bilaterally. We're next going to assess egophony. So I'm going to listen in the lung fields, and you're going to just say E until I tell you to stop. Go ahead.
E.
so voice sounds are muffled equally bilaterally. We're next going to percuss over the lung fields. So you're going to feel me tapping. Okay, so with percussion, the lung fields are resonant, no hyperresonance or dullness. I'm going to next assess for CVA tenderness, so you're going to feel me tapping and just let me know if anything is tender. Any tenderness?
No.
Any tenderness?
No.
Okay, so no CVA tenderness. We're going to next assess the abdomen. So I am going to have you step up and we'll lie flat. This is going to be our exam bed. Okay, and I'm going to lift your shirt. So beginning with inspection, I can see my patient's abdomen is flat and symmetrical. There is no obvious distension, no lesions, no scars. We're then going to auscultate the 4 bowel quadrants. Okay, bowel sounds are normal active in all 4 quadrants. Normally we would listen for 60 seconds in the clinical setting, but for the sake of time in this video, we listened a little bit quicker. Next is we are going to percuss 2 points in all 4 quadrants of the abdomen. So again, you're going to feel me tapping. Okay, so that completes the abdominal exam. You can go ahead and sit up and return to our chair here for a moment. So upon percussion, all quadrants were tympanic with no unexpected areas of dullness. We're going to next assess for vascularity. So we're going to start with palpating the carotid arteries on each side. And these we're going to do one at a time. Okay, carotid arteries are 2+ bilaterally. We're next going to palpate the brachial arteries. You can just relax your arms like this. Okay, brachial arteries are 2+ bilaterally. Brachial pulses and radial pulses we're going to assess next. Again, 2+ bilaterally. And lastly, we're going to assess pedal pulses. Okay, and 2+ bilaterally. We're going to check capillary refill, so give me your hands like this. I'm going to squeeze some nails. Capillary refill is less than 3 seconds. No clubbing or cyanosis is present bilaterally. And again, capillary refill of the lower extremities, also less than 3 seconds. Again, no cyanosis, no clubbing. Assessing for edema, there is no edema present. We're going to assess his brachial and patellar tendon reflexes. We'll start with the brachial reflexes. You can put your palms up and just relax. Good. And the other side. Okay. Patellar reflexes. Lift your leg a little bit. Okay. And the other side. Okay. So reflexes are brisk and reactive throughout, equal bilaterally. We are going to test for sensation. Does this feel the same on both sides?
Yes.
Same on both sides?
Yes.
Okay, so this is going to be dull.
Okay.
This is going to be sharp.
Okay.
Okay, so close your eyes and tell me dull or sharp.
Dull. Dull. Sharp. Sharp.
Okay, we're going to go up to your face and you can tell me also which side you feel it on.
Dull. Oh,
Where do you
right.
feel it? Okay.
Left.
Dull or sharp?
Sharp.
Okay, good. So sensation is also intact. I'm going to have my patient stand and we're going to look at his gait. So you can stand. We'll swap sides here. So I'm just going to have my patient, I'll step back, walk in front of me with his normal gait. Good. And going back, I'll have him walk heel to toe. Good. So my patient has a normal gait and normal steppage. We are going to assess his musculoskeletal system. So I'm going to have him turn and I'm going to inspect the spine. So just inspecting his shoulders and scapulas are symmetric. His hips are symmetric. I'm going to have him do the Adams forward bend test. So he's going to bend forward and we're going to assess the spine. Okay, good. You can relax. So the spine is midline with no abnormal curvatures, so no signs of scoliosis. We can also tell by that test that his flexion is intact. To further examine range of motion, I'm going to have you bend backwards. Good. And then you can stand forward facing the camera, and we're going to do the lateral bend test side to side. Good, and testing rotation, just twist back and forth. Good, so range of motion is intact to the spine. I'm going to have you testing the upper extremities, bring your fists up to your shoulders. Good, back down. And then arms all the way up and back down. Good, and the legs, we'll bring each knee up and down. Good. So range of motion is intact to the upper extremities. We're going to have him lie down on the couch just to assess his hip range of motion. So we're going to bring the knee up to your chest and out. Good. I'm going to go this way so you can see a little better. And the opposite leg, up, out. Good. So range of motion is intact to the lower extremities as well. You can go ahead and sit up. The specialized musculoskeletal test that I will be doing is going to be the Tinel sign to test for carpal tunnel. So I'm just going to have you put your hands up like this. And we're going to tap along the median nerve. If you have any numbness, tingling, pins and needles, let me know. Any numbness, tingling?
No.
Okay, and we can also perform this test going all the way up from the index finger. Any numbness, tingling?
No.
Okay, so that's a negative Tinel sign, no signs of carpal tunnel syndrome. And going back to our specialized abdominal exam that we're going to do for this video, I'll have you lie back one more time. Sorry, you forgot that. We're going to perform the Rousing sign to assess for appendicitis. So we're going to palpate the left lower quadrant. Any pain?
No.
Nowhere, no pain anywhere in the lower abdomen?
No.
Okay, so no pain in the right lower quadrant when the left lower quadrant is palpated. So that's a negative Rothschild sign, no signs of appendicitis. You can go ahead and sit up. And I believe that completes our head to toe exam. Do you have any questions?
No.
Okay, so this was a normal exam for this patient. No deficits were noted during this exam. So,
Thank you.
you.